My CEO, Tove Wang, would have wanted to be here, but as we speak, she's actually welcoming the Peace Prize laureates to our annual Save the Children Peace Prize party. So she had to, she couldn't leave them behind. So I'll do my best to fill her shoes, although that will be difficult, as she has over 30 years of experience in working in child rights and health as a trained nurse and Save the Children veteran, but I'll do my best. As someone working in a child rights organization, I'll naturally focus in on the Child Rights Convention and how it guides and challenges us and our partner governments in our work to ensure health and survival for all children. We all know that states that have ratified the UN Convention on the Rights of the Child are legally bound by it, have made commitment to take the necessary legal, budgetary, administrative and other measures in order to implement it. Apart from the US, all states have ratified it, but still we constantly see that children's rights are being violated, either through lack of will or lack of capacity, or both, from states as duty bearers. Although children's rights to survive, learn and be protected are enshrined in international law, daily basic rights are denied millions of children whom are excluded through poverty and discrimination. Inequity nationally in most countries and also globally is getting worse by the day. And out-of-pocket payments and lack of health workers denies millions of children access to basic health care. Successes in advancing good governance is crucial to realizing Save the Children strategy breakthroughs on survival, learning and protection from violence. And our work addresses and identifies the systemic, underlying and structural aspects that enable or hinder the realization of these rights. By addressing a lack of open, inclusive and accountable governance for child rights and lack of resources to fund obligations to children, we seek to remove these obstacles and create conditions for long-term sustainable change. We seek to strengthen both the supply and the demand side of accountability. We support citizens, including children, to hold governments to account and other providers accountable by directly engaging in government policy and financial planning processes, as well as social accountability processes to improve access to quality of services. Together with local partners, Save the Children also assist the children in understanding and acting for their right to protection, sexual and reproductive health rights, right to education and to nutrition. Let me give you an example from Malawi. In one of our programs in Malawi with a special focus on sexual and reproductive health and rights and education, we interviewed 130 school youth groups of girls on their safety by putting the girls in groups of 5 to 7 from the same community, asking them to draw a map of their way to school. In the map, they pointed out where they felt safe and where they did not feel safe. And one of the many examples that was common to these girls was that they did not feel safe in the classroom when the teacher left because the male students harassed them. With this information, we got through child-friendly surveys. Local partners set up meetings with local stakeholders. In this case, they were teachers, parents, local authorities, youth clubs, health workers, etc. And together they made concrete action plans on how children in their communities could feel safe. One part of the solution in this case was that health workers and teachers discussed SRHR and how respect and SRHR issues should be dealt with at school level. And local politicians were also brought in both to recognize the problem, but also to discuss how they are part of the solution. We also followed up at national level by establishing an interdepartmental dialogue on this issue and sexual and reproductive health more broadly, including curriculum, and pushing for more resources which could give more health workers and teachers, as well as better quality and access to health services. There has been a different approach from health ministry and education ministries on this issue before, but now those two ministries come together 4 times a year to discuss SRHR issues, which we believe is a great progress. I would very much also like to dive into the aspect of investment in children and how taxation is key to this, which comes to but I'll hopefully do that during our dialogue afterwards, so thank you.